Hello, I'm Vivian Gibson. I'm host of the Circle of Hope show, along with my co-host Lisa Davis and my other co-host Dolores Thompson. Today we're going to be talking about diabetes in a different way. We've done our series with the endocrinologist and he told us what diabetes is, but we're going to do something different here today. We're going to talk about management of diabetes, and our guest is Mr. Bob Chrysler with the Health Medical Spark program here in Jackson. Welcome to the program, Bob.
Thank you very much, Mrs. Gibson. It's a pleasure to be here.
Ever since I met you, I could see that you have such a passion for helping folks with diabetes. And this is something that's in your personality. It's just every time I talk to you, you're talking about preventing, you're talking about management, and so I'm just so impressed with that. Tell us a little bit about your company.
Well, like Circle of Hope, we're in the business of helping people. And as my 92-year-old mother always tells me, the secret to happiness is doing for others. When I learned about all the complications involving diabetes and that we could do something about that, it seemed like that's a mission that we should begin. Our company, Medical Spark, began as a company that focused on clinical research. We would work with pharmaceutical companies to do drug studies. But a funny thing happened. Not a funny thing, but an interesting thing happened. One of our people we work with became diagnosed with diabetes. And he attended a local education program, which is designed to help you manage your diabetes. Because as we know, diabetes is a self-managed disease. You know, when you go to the physician or the provider will tell you how to manage your disease, and then you're out into the world on your own for the next 3 months before your next office visit. Well, depending on the physician, it could be 3 months or less. Well, we kind of thought that if we could provide people with the adequate education, support, and encouragement, and cheerleading to better manage their condition, that we can make a difference in people's lives. And we figured that, could we make a business out of this? We were thinking, could we make a business from this? And we realized that there was not a lot of opportunities for people who were struggling with diabetes or families dealing with diabetes had as options to turn to. And so we began the process of becoming accredited to be able to offer diabetes self-management education. And from there, you have to work with insurance companies to receive insurance numbers so you actually can reimburse for seeing the patients. And then we work with local clinicians to be a resource for them to be able to refer patients to us. So the way it works now is a patient who has diabetes, the physician oftentimes will say, I'm going to refer you to these people, and they're going to take care of you. This is our patient packet. It kind of explains who we are and what we do. And there's a handy dandy little perforated sheet for a referral form. And this is how we receive our referrals. When a physician refers a patient to us, if they're a type 1 diabetic, we will see them the same day. If they're a type 2 diabetic, they'll be contacted the same day we receive the referral and be seen within 1 week, whatever our scheduling allows. And also, we work around the patient schedule. It's not like, okay, you're going to see us on Tuesday at 2 o'clock. We ask the patient, what is best for you? How do we work this into your schedule? Because again, this is kind of a patient-centered process that we have. And since this is all we do, we have all the time in the world to work with patients. And so that's the basic model that we have for working with patients.
That is just amazing. It's just amazing, Bob. I knew once we were confirmed you in, you were going to give us the information that we needed here. Show some of the visual aids that you have.
Well, it's interesting. When you come to us for the first time, our program is broken up into several components. We spend about 10 hours in the first 6 weeks with a diabetic patient. Your first visit with us is a 1-hour, one-on-one session with one of our registered dietitians. And we spend a lot of time in learning about the patient's specific needs. Well, a detailed questionnaire about, nutrition, and just the things that make up your life. Your exercise, what you eat, what you don't like to eat, and all these kind of things. We beginning a personalized education program for the patient. And so it's amazing how much I have learned and how much people learn by coming to us, because some of these things you take for granted, like some of the things that we share with people are like, when you see that this is how much sugar is in a 20-ounce soda, this is amazing. This is just one of those little tools that we use that really kind of bring some of this home to patients. They see that kind of thing, and they realize, good Lord, I'm having that much sugar in this drink. Well, that's incentive enough right there to,
Change your diet.
Absolutely. And then we do things like, here's an example. Got a question for y'all now. All right, 2 boxes of Whitman Sampler. Now, this is the dark chocolate assortment, the one you find anywhere, and this is the sugar-free sampler. Now, if you were shopping for a diabetic, which one would you think would be best for the diabetic?
The sugar-free.
Sugar-free?
The sugar-free.
I would think sugar-free.
Well, I would think that too when this was first presented to me. But the opposite is actually true. We teach patients to read food labels, to be able to count their carbs and know what they're actually getting. It seems that there are less carbs in this one than in the one with sugar. But actually, the sweetener here is sugar alcohol, which is much worse for the diabetic than the one with sugar in it. A lot of little things like this, it's not all about Whitman samplers, but we do break down a lot of things that are very practical and very much a part of people's lives and try to make it make sense to the patient. Because we're trying to meet people where they are with things that make sense to them in a very meaningful way.
Well, apparently they're being taught that, because a lot of people seek sugar-free candies and different items because they're diabetic. So the information is coming from somewhere.
Well, it's correct, but it may be just a misconception or misunderstanding of how these things work. Gosh, I've got diabetes, I should have the sugar-free. Right. In this instance, the sugar-free is not the better one. Oh. And there are a lot of things like that people, common sense would tell you one thing, but the actuality is something else entirely different.
I'm glad that you said that, because even for those who are already diabetics and they would think that sugar-free is better, and even, with myself, I'm thinking, what can I do to prevent it? So I would start getting sugar-free, items myself, just as a way of preventing me from getting diabetes, because I'm thinking, the less sugar I intake, the better it's going to be for me.
Well, that's the beauty of a diabetes education program. As we all know, you hear people every day talk about education is the key for children or for people enhancing their lives. Well, that holds true when you're dealing with a chronic disease also. And so what we try to do is to make sure people are well prepared to follow the physician or the provider's instructions, and by understanding the things they say, because a lot of people, if you're in with your doctor and you're dealing with something like diabetes, in the time that you have with them, you may not think of everything that you would need to ask or like to ask. Well, this is what we're for. And also, there's some things that you may be embarrassed to ask in certain situations, and that's why we have a very guided curriculum that asks very specific questions that are very pertinent to the care of your diabetes.
So with me hearing your passion and what you're doing, if I were someone who needed to come to your center, I could count on the fact that you're going to treat me in such a personal way. In other words, I can hear that you have that personal touch.
We're going to take a break. We'll be right back. Dolores, you were asking Bob a question that you...
Yes, I was just saying that, you know, Bob seemed to be so personal, and he really is, you know, has such a passion for what he's doing. If I were a person who was a diabetic, I would be seeking a center like yours to help me manage.
Well, I'm glad you see that, because we've chosen very carefully the people that we work with. We focus on the positive sides of things. So many people, when they're diagnosed with diabetes, they will come in and their life has just changed. And they can be very emotional, and they can be very, very concerned, angry, confused. And when they come in, we want to make our place very warm and fuzzy for them. And a lot of our patients, once they've gone through our program, which is not kind of a one-time event, it's an ongoing program, patients will come back and just come to our office and sit and talk to us. And another one of the benefits we offer local clinicians is that if your patient has questions specific to their diabetes, we have certified diabetic educators on staff, we have RNs, we have a PharmD, and we have diabetics on staff. And so if you've got a question, you call us anytime. With most of our patients, we give them the personal numbers. Our dietitians are educated because questions arise sometimes not during business hours, and we want to be accessible to our patients. So we have a real upbeat, optimistic approach to managing diabetes. You're going to be fine. We're going to help you with this. We're going to help you feel better. And we also have some other tools that we use to enable us to maintain that connection with our patient. A little tagline says Medical Spark: listen, connect, learn. Well, the connection part is not just a cute little tagline, it's actually meaningful in that we utilize technology. You know, there's some things machines do well, and some things they don't. And one of the things they do well is to be able to connect to people, and we utilize text messaging, email, or phone calls, and the patient gets to choose what they prefer as their means of contact. Okay. And you could get a text from us that could say, "Happy birthday," but also could say, "You taking your medicine today?" And we have this kind of interaction with the patient. And in turn, we're getting data from the patients very important to their care. We provide that to their physician, which is very meaningful for the physician because there's a whole coming wave of healthcare reform that's very data-driven. It's focused on very specific aspects of a patient's condition that are very, very important to the doctor and can benefit the physician, but also enables a better continuum of care. So we remain connected to our patients throughout as long as they would like. Some people want that kind of a connection, some people don't. But we found that most of the people who come to us are the proverbial fertile soil, people who really want to take care of themselves. Now, there's some people who just do not want to take care of themselves. I've not figured that one out yet, what to do. But for the people that do, we want to be the place for that.
Okay.
That's wonderful. I was visiting your office one day, and you showed me a infected foot, and you showed me all the various valves for hamburgers, French fries, and I was just personally, I do not want to get this disease.
Oh, well, I just happen to have a couple of those over here. Education is really key to a patient taking better care of themselves, and these are things that I didn't know. And if you hadn't had experience with this, you wouldn't know either. So we explain to patients the significance of things like a foot check, a small cut or something like that doesn't heal well can easily turn into something that's very, very, very difficult and damaging. And we were talking earlier about amputations and things associated with diabetes. Well, we can't keep someone from getting diabetes, but we can darn sure stave off some of the complications that are inherent to the disease. And again, that goes back to the significance of the education is key to that. So if you know to look for these things, And also, the technology we were talking about before, we utilize that to remind patients, because we know these things about the patients, so we ask them about their eye checks. You hear about people who lose their vision from diabetes. That's really important to go to your eye doctor regularly. And also, like foot checks, things like that. And we look over people's shoulders and we encourage them to do this. We send them reminders when it's time for their foot checks and their eye checks. And we're just cheerleaders for them. We remind them that you can do this. You can take better care of yourself. You're going to feel better, and your family's going to benefit from that too, and the community.
I tell you, Bob Chrysler, I think you're going to make a world of difference in the lives of patients and those who have diabetes. I think you're going to make a difference.
Well, that's certainly our intent.
Okay. We'll be right back. Welcome back, Bob. You've just brought so much information here. It's just so wonderful. I think Ms. Thompson has a question, very important question for you.
Yes, Bob. In dealing with the management portion, I just wonder if spiritual belief, a form of spiritual belief, can help the patient in their management or their desire to manage.
Well, personally, I have a strong belief in that what we're called to do is kind of to care for one another. And so that means a lot to me. But I believe that, respecting your body and caring for your body and doing things that are good for your body, they're certainly to follow spiritual beliefs that people have. And so we would like to think that in some of these areas we have a lot of diabetes and people are not caring for themselves very well, we feel like that working through some of the churches may be a great idea. Not saying we've got all the answers to everything, but
Right.
when we have leaders in the community saying, you guys need to take care of yourself.
Right.
And this is one of the ways of doing that.
Yeah.
Bob, tell us about some of your goals that you plan to meet in the areas where there's a disparity for this kind of treatment.
Well, we do have grand designs on expansion to areas that really need our help. A stat that I'm familiar with cites Mississippi is 50th in the country in metabolic disorder, which includes diabetes, cardiovascular disease, and obesity. We have 86 counties in our state. There's 5 counties, if you remove them from the state, Mississippi catapults to number 22 in the country. So, We have identified these areas and we have plans for expansion into these areas because we feel like a permanent medical spark presence in these communities. We want to be involved with the churches and the schools. We want to make it cool to take care of yourself. And so, yes, we have our business model calls for us to be in some of these areas. You know, Holmes County, Mississippi has the lowest life expectancy in the country. And Ms. Thompson, you know a lot about Holmes County, Mississippi, don't you?
Yes, that's right. I'm from there.
And we want to make a difference in people's lives because that's what Circle of Hope is about, and that's what Medical Spark is about. The fact that we're a business is necessary so we can feed our families, but if we can help people and make it a living at the same time, I feel like that's what we should be doing.
And yes, Bob, I thank you so much because just with your passion alone, you know, to help, and with my passion to help, you know, I believe we can go into Holmes County and help and make a difference.
Well, fortunately, Medical Spark is not just me. We have a great staff of people who really care and who have an equal passion for what we're doing. But also, there's a whole lot of doctors out there who really see the benefits of what we're doing, and that kind of fuels our passion. I believe in what we do because I see this on people's faces. I try to visit with every patient who's referred to us and let them know we got your back on this. This is what we're here for. We're going to be your cheerleader, your supporter, and your encourager on this, and you're going to be able to take care of yourself.
Now, Bob, I know this is not free, okay?
That's correct.
So let's talk about people who might not have insurance, or if your insurance will cover it.
Well, that's correct. We're accredited by the American Association of Diabetes Educators. And because of that, we have Medicare, Medicaid, Blue Cross, Blue Shield, Aetna, Cigna, whatever your insurance provider is, we will see patients. And if patients have no ability to pay, we do, like a lot of physicians do, we're going to see a patient. We're not going to turn a patient away simply because they don't have insurance. We also have a cash play program that we can do for some people who just choose to do it that way, to self-refer and do that way. But we're not ever going to turn a patient away because they can't pay.
So how can someone contact you to get?
Well, that's great. Traditionally, it is done by referral form, which physicians all across our area have. And in our little folders here, it's a perforated sheet. It's a very simple form where the physician says, I'd like you to educate this patient. But people can call us.
You have a website?
We certainly do. medicalspark.com.
Great.
And Bob, you plan to, you're going to actually work in the Holmes County area. Is that your goal to do at this point?
Absolutely.
Absolutely. Absolutely. That's wonderful.
So there's 5 counties you're saying that's causing the state of Mississippi to be number 50.
Well, there's a lot of factors in there. I don't think it's quite that, but if you look at the numbers and you remove those counties, that's how we go to number 22.
And those are the counties you're targeting right now.
We are not in those counties yet,
You're
but we're
not.
working with the hospitals and physicians there to put our flag in there.
That is so wonderful. We'll be right back. Welcome back.
Okay, Bob, I'm still on this information as far as how can a person who has not gone to his doctor contact this organization in order to help them with their diabetes care.
Absolutely. On our website, medicalspark.com, there's a referral form there. Or you can simply call us. Our number and our location in Flowood is 601-932-2140. 932-2140. And I can be reached at bob@medicalspark.com.
Well, Bob, I think that you're going to make just a tremendous difference because you have it in your heart to do this. And we're going to do everything that we can to make sure that we help you.
Well, to borrow a line from Ringo Starr, I get by with a little help from my friends, and thanks to you, maybe we can make a difference in people's lives.
We will. Bob, we want to thank you for coming to our show today, and your information is awesome, and this is so important. But we thank you so much for coming, and we hope you'll come back. Thank you for viewing us today, and hopefully you will come back.